Today, I am so delighted to speak to Dr. Veronica Couture. She is an integrative psychiatrist, and we're going to be talking about the 4-7-8 breathing technique to reduce stress and reduce anxiety and help regulate your nervous system. This is a super easy technique that you can use at any time, any place, just to help you feel more calm. So we're going to talk about that today. If you want to learn more about how to improve your mental wellness and reduce anxiety and improve sleep through an integrative, holistic, evidence-based lens, then go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I am an integrative psychiatrist and sleep physician, and I'm the founder of Pacific Integrative Psychiatry. And we see patients all across California, and we help people with anxiety, depression, sleep issues using integrative psychiatry. So today we have Dr. Veronica Couture. She's one of our psychiatrists at Pacific Integrative Psychiatry, and we're talking about 4-7-8 breathing. So Dr. Couture, could you tell us a little bit about what that is and what are some of the benefits of doing breathing practices?
Thank you. Thank you. Good morning. Well, the breathwork in general can give a sense of calm, help you fall asleep easier, have better digestion and overall quality of life. And almost anyone can do the 4-7-8 breathing technique. There's no equipment needed. It can be done anywhere, standing, lying down, sitting. It's free. It just takes a minute or two. So the 4-7-8 technique can help with insomnia in combination with other treatments, but it definitely can help with anxiety. And one study found that after 6 to 8 weeks of consistent practice, there was lower heart rate, blood pressure, improved digestion, better circulation. And, Dr. Andrew Weil, the founder and director of the Andrew Weil Center for Integrative Medicine at the University of Arizona, has said that it's the most effective anti-anxiety measure he's found. That's a pretty big statement. Yeah. Another study done with patients with chronic obstructive pulmonary disease, COPD, experienced reduced shortness of breath, less anxiety, and
That's really amazing, actually, that even people with these sort of severe or, chronic medical issues can benefit from
yes,
it. And like you
yes.
said, it's free, right? It's accessible to everybody.
Mhm. Yeah, I love it. I love it. It comes from pranayama, which, as you know, is the breathing technique used in yoga, and yoga breathing, as I'm sure a lot of folks know, was developed in ancient India. The 4-7-8 breathing technique specifically was taught by Andrew Weil as the 80s, and basically what you do is you take a full breath in over a period of 4 seconds. You hold the breath for 7 seconds and you breathe out slowly over the period of 8 seconds. And I do 8 repetitions. Each time I do this, I do 8 reps. And it really can help restore balance to the nervous system.
Yeah, and I love that, like you were saying, you can do it anytime, any place. And I sometimes will do it during meetings or things like that, and no one needs to know that you're doing it,
I
right?
love that about it.
Yeah, and it has that instant calming kind of effect. And I think I'll just highlight something because I hear this a lot from people where, if they have anxiety, they might say, when I do breathing practices, I feel more anxious. Um, and what I typically recommend is then you want to focus on the exhalation. You want the exhalation to be longer than the inhalation because you don't want to trigger a hyperventilation response. And with the 4-7-8, that's what you're doing is you have a longer exhalation than the inhalation. Could you maybe speak to that a little bit?
Yeah, yeah. So the reason it's effective is and the reason that I like it especially is because it makes sense based on what I understand of the nervous system, based on what we all know about the nervous system. So, as you know, the autonomic nervous system is made up of two parts. There's the sympathetic branch, which triggers the fight or flight response to danger. For example, if there's a tiger chasing you or an upcoming deadline, and it's linked with the inhale, the startle, gasp, surprise, fear, and this branch, the fight or flight branch, it increases your heart rate, your breathing, and preparation for running away or fighting off an attacker. Whereas the parasympathetic branch triggers the rest, relax, and digest response during relaxation time. You know, when you're lying around, you've just eaten a meal, you're relaxing, and it's linked with exhale. You know, that sense of calm, and the rest relax branch is linked to digestion, your heart rate, and your immune system. And like you said, the 478 is the opposite of the kind of breathing that we do when we're stressed out. And it gets us to breathe through the diaphragm, which if you do breathing exercises, you know that that's important. So, as you were saying, the 4 second in breath that shortens the inhale, quieting the fight or flight response. The 7 seconds of holding the full breath also stimulates the parasympathetic, the rest, relax, digest branch. Um, uh, Linked to digestion, heart rate, immune system. The 8 second out breath lengthens the exhale, also activating that rest, relax, digest response. And so, yes, we're strengthening the parasympathetic nervous system to induce a state of relaxation, to slow the heart rate, help with digestion, lower stress hormones. Basically, we're working out that weaker muscle that we have in anxiety, we're strengthening it. Yes.
Excellent. Yeah, that's really helpful. And I'm curious, how you might suggest someone practice it. First of all, are you recommending nasal breathing? So should they, do the 4, 7, 8 in and out through the nose? Is there any mouth breathing involved? So could you explain that? And then we can talk about maybe like when to practice it.
Yes, yes. Well, Dr. Weil had a slight variation to the way he did it. He actually used the tongue to press on the sort of the back of the front teeth. I've really just simplified it. The most important thing here is shortening the inhale, lengthening the exhale. So, in fact, a quick way to do this, if you can't think of it, which I also use, is that quick inhale and exhaling like you're breathing out through a straw. A straw. And that can take a while, and that can also simulate the 478 breathing technique. So it really is very simple. And for folks who have anxiety on more of a frequent level, I do recommend doing 8 repetitions twice a day and an additional once a day as needed. So, like you were saying, if you're in the middle of a meeting or you're just running errands and you feel all of a sudden, this sense of anxiety coming over, you can do that at any time. Yeah. And so you could do it before bed, alongside your wind down routine if you just want to do it at bedtime. If you wake up in the middle of the night and you're having trouble falling back to sleep, you can do a round of 4, 7, 8 breathing. So basically, you could do it at point throughout the day.
I really like that idea of having those two checkpoints. So morning, evening, and then in the middle of the day or, during the day as needed. I like that a lot because you're intentionally activating that parasympathetic or that rest and digest response. And most of us are in the sympathetic fight, flight, and freeze response most of the time. So if you actually like take the time to build in this very simple breathing practice, it can really, provide some good benefits.
Yes, absolutely. And once you integrate it into your routine, it becomes second nature. And it took me a while to get it right. And initially, I did get those worried thoughts of, "Oh, I'm not doing right." And so it did take me a while to feel comfortable with the technique. And practice makes perfect. If you do struggle with it, be patient. It's like anything else that you're training for. You're working on your triceps instead of your biceps, and it takes a while to learn something new. Yeah. So you could use the 478 breathing technique along with other relaxation techniques, in addition to like progressive muscle relaxation, visualization, meditation, prayer, all those things. Yeah, yeah.
Yeah, excellent. Great. So that was a quick overview of the 4, 7, 8 breathing. And so what I would suggest, to anyone who's listening or watching this, give it a try. You can always rewind and listen to Dr. Couture's instructions again to learn how to do it. Give it a try, keep it simple. Don't worry about putting your mouth behind or your, tongue behind your teeth or any of that kind of stuff. I agree with you. I like keeping it simple because
Yes.
in yoga, there's also specific techniques with tongue placement, and there there's other aspects to it that you don't need to worry about because those are more advanced techniques typically. So just keep it really simple, as Dr. Couture was saying, and give it a try and see how it feels. Um, Dr. Couture, could you share more about, your practice if people want to work with you and learn these sort of integrative modalities? How can people find you?
Well, I invite people to visit our website at pacificintegrativepsych.com, and you can schedule a call with one of our team members, and that'll get the process started. And you can schedule an appointment to meet with me if you're interested.
Wonderful. Well, thank you so much. And in our next video, we are going to be talking about gratitude. So stay tuned for that. And we'll say bye for now.